Hello, my name is Dr. Hillel Mazansky and I specialize in medical hypnosis, guided imagery, nutrition and exercise. I'm coming to you today from San Diego, California. Please read my new book titled Empower Yourself with Medical Hypnosis, available on Amazon.com, and if you do, you will live a longer, happier, healthier life. Today's health tip is titled, Could You Be Depressed? It's natural to feel down sometimes, but if that mood lingers day in and day out, it could signal depression. Major depression is an episode of prolonged sadness, along with symptoms that last for a few weeks or a few months. It's a major health concern, but treatments are available. The primary symptoms of depression are a sad mood and a loss of interest in life. Activities that once were pleasurable lose their appeal. Patients may be haunted by a sense of guilt and worthlessness, lack of hope, and recurrent thoughts of suicide. Depression is sometimes linked to physical symptoms such as fatigue and a decreased energy, insomnia, or early morning awakening, or excessive sleep can be symptoms. Others are persistent aches and pains, headaches, cramps, or digestive symptoms. Depression can make other health problems feel worse, particularly chronic pain. Changes in appetite or weight are another hallmark of depression. Some patients develop an increased appetite, while others lose their appetite completely. Depressed people can develop severe weight loss or weight gain. Without treatment, the physical turmoil brought on by depression can derail careers, hobbies, and relationships. Depressed people can find it difficult to concentrate and make decisions. They turn away from activities that once were pleasurable, including sex. In severe cases of depression, it can become life-threatening. People who are at risk of depression are more likely to commit suicide. Worsening signs include talking about death or suicide, threatening to hurt people, and engaging in risky behaviors. Anyone can suffer from major depression. Many experts believe that genetics play a role. Having a parent or a sibling with depression increases one's risk of developing the issue. Women are twice as likely to develop depression than men. Depression is extremely high in Ashkenazi Jews. The reason for that is most probably on a genetic basis. Doctors aren't sure what causes depression, but a prominent theory is that altered brain structure and chemical imbalances exist in the brain. Experts also believe that while stress, such as losing a loved one, can trigger depression, one must first be biologically prone to this disorder. If your mood matches the season, sunny in the winter and gloomy, sunny in the summer and gloomy in the winter, you may suffer from a depression called seasonal affective disorder, or SAD, S-A-D. Experts say that SAD affects 3 to 20% of people depending on where they live. The sunny climates, SAD is less, and in the snow and the winter time, where the sun doesn't shine as much, SAD is worse. Postpartum depression, or the baby blues, strikes as many as 3 out of 4 mothers. This is known as postpartum depression. Something of importance in this type of depression is that the baby's safety may be at risk. A depressed mother may have difficulty in nursing the baby and enjoying bonding with a newborn child. In the United States, depression affects 2 to 3% of grade school kids and about 1 in 10 teenagers. Symptoms are similar to those of adults with depression, but some children may appear angry and engaging in risky behaviors called acting out. Depression can sometimes be difficult to be diagnosed in children. There is no laboratory test to diagnose depression. To make an accurate diagnosis, doctors rely on the patient's description of their symptoms and the history. Talk therapy can fight mild to moderate depression. Cognitive behavior aims to change thoughts and behaviors that contribute to the depression. Interpersonal therapy identifies how your relationship affects your mood. Psychodynamic psychotherapy, on the other hand, helps people understand how their behavior and mood are affected, but unresolved issues and mood are affected. Hypnosis works extremely well for depression, as under hypnosis you are able to delve into the subconscious mind. Oftentimes, childhood incidences are so repressed that they do not know that that was the cause of depression. While under hypnosis, we are able to elicit what happened to them. Oftentimes, sexual abuse is prominent, and then treat them. On my website, drmedicalhypnosis.com, is a hypnosis video for depression for your information. Antidepressants affect the levels of the brain chemistry such as serotonin and norepinephrine. But the medication often takes a few weeks before it becomes effective. If the first medication doesn't work, there are many others that can be tried, and eventually one will be found that will be of help to you. Unfortunately, many of these antidepressants have side effects, especially sexual in nature. The combination of medication, talk therapy, and/or hypnosis appears to be extremely effective. Records suggest that exercise in a patient is a powerful weapon against depression. Exercising for 20 to 30 minutes, 6 days a week, doing the cardiovascular type, increases the serotonin, or the feel-good hormone. Light therapy has been shown to be effective against SAD or SAD, but for other types of depression it may also work. It involves sitting in front of a light box for a period of time, and the light is either bright, dim, or blue in color. Pets can ease the symptoms of mild to moderate depression. Pets provide unconditional love, relieve loneliness, and give patients a sense of purpose. Developing a strong social network can be an important tool to fight depression. Join a depression support group and make a concerted effort to be engaged with family and friends, as this can be extremely beneficial for you. Another option for severe depression is ECT, or electroconvulsive therapy. For this treatment, the patients are placed under general anesthesia and shocks are given to the brain that cause a seizure. This can be effective in 80 to 90% of patients, but one side effect is that it can cause memory loss to various degrees. A new form of treatment is called transcranial magnetic stimulation, or TMS. This treatment uses electromagnetic pulses on the skull, and it stimulates a tiny electrical current in a part of the brain linked to depression. TMS does not cause a seizure and appears to have a few side effects. A drawback, however, is that this treatment is extremely expensive, as usually 12 to 20 treatments are usually needed. In the midst of a major depression, you may feel hopeless and helpless, but the fact is that the condition is highly treatable. More than 80% of patients get better with medication, talk therapy, or hypnosis. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.